Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey, everybody. Welcome to this episode of Research Perch. I'm going to be your host for today, Dr. Niki Munk. I am the head of the Massage Therapy Foundation's Research Committee, also a trustee. And for those of you who have been with Perch for a long time, it's a little bit of a throwback day because Ruth Warner and I were the original hosts, and it's really fun to be back after so many years to come and actually host a Research Perch with you guys. I know I look a little different. It's about 10 years since well, no, not quite 10 years, but it's been a while. I've moved offices, so my environment's different, but I'm really excited to come and talk about some things that we've got going on, and particularly highlight my student, or a student who works in my lab, a doctoral candidate. Her name is Sami Zabel, and she's here with us today. Hi, Sami.
Hi, how are you?
Doing great. It's really wonderful to see you and give this opportunity for you to talk a little bit about the research that you're doing.
Same.
Yeah, so just real quick too, you guys may recall or know that we have the Massage Therapy Foundation has relaunched the MassageNet, which is the PBRN, the practice-based research network that helps to link practitioners and clients with researchers and important research that is reflective of the field. And we are incredibly excited to share that in addition to getting that relaunched and getting that built, you may have seen Sami talking about that PBRN. We also have some studies that have launched and are actually being conducted through the PBRN right now, including Sami's dissertation work. So we're here to talk with Sami about that. Are you ready?
I am. I hope everyone else is.
Yeah, fantastic. So I've got a couple of questions prepared for you to be able to talk about these things. So first, tell us the name of your study and a little bit about what brought you to this. So some of the background information and the prior work that you've done in this area that has led you to this particular study.
Sure. So the study I'm talking about today is called Massage Therapists' Attitudes and Knowledge About Mental Health, an Explanatory Sequential Mixed Methods Study. It's really long. It's a little bit complicated, but for me anyway, it's super interesting, and I hope it's super interesting for everyone else as well. As I've been going through my my doctoral studies, I've been learning more and more about massage therapy research and just how little there is out there and how little we really understand about a lot of aspects of massage therapy, how it works, who we are as a group of people, things like that. So one of the things that I particularly found interesting was how massage can be used to support mental health. When I was in massage school, I did a case report on a client who had issues with anxiety, and she reported that she really felt a lot better after getting massage treatments. So I thought that that's something I want to learn more about. And because there's not a whole lot out there, I thought maybe I can be one of the people who can start working on that. So I did a study, when was it, like 2 years ago? I think it was 2 years ago, 3 years ago, something like that. I think at the beginning of the pandemic, yes. about there's a study going on at the VA in Indianapolis, and I was looking at the massage therapist notes from that study just to kind of look at what people are recording about mental health and how mental health is thought about. What do massage therapists think about mental health, and why is it important when they write it down? So I thought this is a good starting point, but there's still a lot that I don't know, which means there's a lot of other people don't know too. So what do massage therapists know and understand about mental health? And as a group, there's pretty unclear expectations as a field about what our role is in mental health. It's kind of outside of our scope of practice to treat mental health, but it's definitely affected by what we do. So how can massage therapists be used to kind of support that?
Absolutely. Well, no, and ultimately, people seek out massage therapy to either support or help with mental emotional well-being type pieces, whether it's anxiety or depression,
Right.
what have you. And even when they're not, that's not their first order or reason to seek out massage therapy. These are sort of the perhaps unexpected side benefits. I think there was a study that Geraldine Cameron did that was looking at side effects. And one of the things that was the unanticipated, they were expecting, well, I had a little bit of soreness or whatever, but one of the surprising results to that study, if I'm remembering correctly, was, oh, well, I felt so much better and I just seemed happier, my emotional well-being. So some of these things that weren't necessarily expected. So yeah, absolutely.
And I found that was my experience with my case report that I mentioned. My client came to me for restless leg syndrome, but she ended up, the restless leg syndrome was sort of affected, but the anxiety was really what she came away with.
Yeah, absolutely. So what then specifically, so you've talked about what got you to this work. What specifically are your research questions that you're wanting to answer, or perhaps you asked another way, what are the specific aims of this study?
All right. So there's three things that I'm kind of looking at, three questions that I'm looking at. The first thing I want to find out is what specifically do massage therapists as a group know about mental health? So their mental health literacy, basically. So I want to know what kind of things do people understand about how is mental health issues diagnosed, like depression, anxiety, PTSD, things like that. What do people know about how to identify mental health issues? And then the second part that I'm going to look at is what are massage therapists' experiences with mental health in real life? So in their education, what have they experienced in their education regarding massage therapy, or just in general? What have they received education wise, and what are their personal and professional experiences? So in their family life or their friend life, just outside of practice, what are their experiences with mental health, and then their professional experiences in their practice.
Excellent. So how are you going to measure those pieces?
So the first part, what do people know, and their kind of views about mental health, that I'm going to be using two validated assessment tools. The mental health literacy is going to be assessed with the mental health literacy scale, or MHLS, which asks questions about like, what is depression? How is depression diagnosed? How do you identify depression? Things like that, and then I'll also be using the community attitudes toward mental illness scale, CAMI, which is looking more at how do you view people with mental health concerns. So if there's someone in your neighborhood who has PTSD, what is your kind of viewpoint on how you should treat that person, or things like that?
Are there other clinical fields where these assessment tools have been applied?
So yes, actually, the MHLS has been used in a variety of healthcare fields, in social work, things like that. And the CAMI it was originally developed for community use. So just like going out into community groups to figure out how do people see people with mental health issues.
So it sounds to me like there may be opportunity with results from the study to be able to talk with other communities and other clinical disciplines to give them a little bit of a couching of how massage therapists engage and think about these aspects. So that's a really nice communication entry then with this interdisciplinary work.
Absolutely, yeah.
Fantastic.
Yeah, and then the last part I'm looking at is the people's experiences. That's going to be measured with I'm going to be asking interviews. So people who have taken the survey part, I'm going to be inviting those people to participate in interviews with me, like 30-minute interviews or something, to get more into their experiences and what happens behind the scenes, kind of. Does that make sense?
Excellent. So it sounds like there's a two-part piece to it.
There
right?
is, yes.
All right. So one of my next question, I think you've answered this already somewhat, is if somewhat, because you're absolutely wanting massage clinicians, currently practicing massage clinicians, to participate in this study to inform practice, right? So what would participating in this research look like, and how might one be able to participate?
All right, so the survey portion, the part with the MHLS and the CAMI, that's an online survey, completely online. You can do it on your own time. It should take, 20, 30 minutes to get through. I want to say there's something like 90 questions or something like that, but they're pretty straightforward for the most part, and I think it'll give me a lot of information about what people know and understand, with not a lot of effort on your part. Sure. And then the interviews, that'll be scheduled over Zoom. So again, wherever you want to be, whenever you want to do it, take about 30 to 40 minutes, something like that. And then I'll just ask you questions and you tell me about your experiences.
So, but it won't be everybody that gets surveyed. It'll just be sort of a selection of folks to get
Right. The survey will only be a small number of people that take the survey, the interview. Sorry, the interviews will be a small number of people.
Because I would imagine you're hoping for as many people as possible for the surveys, right?
Right.
Absolutely. And then possibly 20, 30 max interviews, something.
I'm looking probably about 15 or so people for the interviews, but as many people as I can get for the survey. Right.
Absolutely. And are there, so in addition to helping inform about our field and about their experiences in practice, are there any other initiatives or benefits that they may be able to, so incentives to participate?
Sure. So the people who participate in the survey will be entered in a drawing for a $25 Amazon gift card. Oh, nice. So there'll be 3 of those available to kind of divvy up. And it'll be at the end of the survey, everyone will be placed in a drawing and 3 people will get a $25 gift card. Great. And then the people who participate in the interviews, everyone's going to get a $25 gift card.
I seem to remember that. Yeah, that's great. Nice additional incentives for that. Indeed. So how do you think this work will impact first practice and then also patients and clients of massage therapy?
So I think one of the big things that I want to come from this is by better understanding what do massage therapists know about mental health, we can better develop educational resources to support that. So are there gaps in knowledge about mental health, and how can we kind of fix that? How can we make sure that people know what they're looking at when they have a client who comes with a mental health concern? What are the red flags that you can identify so that you can help people get the help that they need? You might not be able to treat someone with anxiety, but you can definitely point them towards someone who can. So how do you identify these people and get them the help they need?
So it sounds like there's a little bit of an intersection too around education, right? Yeah, I love it when
absolutely.
The 3 tripartite mission pieces come together.
Yes.
Wonderful. And then I always like to ask questions when we're going to research talks and things. What are the next steps? So we've got what you're interested in now, what you've done, what you're interested in now, and you're doing. What are the next steps to this research?
So the next big step is, once I've gotten this study done, I'm going to be looking at what our client experiences with mental health in massage therapy. So how I'm going to plan to do that is I want to look at I'm going to ask the people who have participated in this study, mostly in the interview portion of the study, to identify some of their clients that they know have reported mental health issues, or they've identified mental health treatment goals within their care with them. Yes.
Right.
Okay. So if we can get some of these people to participate in interviews with me, then I can get a better idea of how the massage therapists affect the perceptions of their clients. So see how a massage therapist's knowledge about mental health, how does that affect the client experience regarding their mental health?
Oh, that's really interesting. And one of the things that makes me very excited about this study particularly is because it does touch on so many of the different missions of the practice-based research network, which is to not only link researchers to clinicians for, clinician type or practice type research, but then to also link researchers to the recipients of the care, so patient populations or client populations for those types of research pieces. So that's really exciting, Sami.
I'm excited.
So, and just to reiterate, right now you're recruiting principally through the PBRN, through ResearchNet. So those who are, or MassageNet,
yes.
So those who are already members of MassageNet or participants within MassageNet are able to, there's like a QR code that you have with your study flyer that's going out to those within MassageNet.
Right.
So for folks who are interested to become a part of MassageNet, and then they have access to be able to engage with your research and your study. And of course, when this gets finished, you'll be reporting back out, right? So this is something that will be going hopefully to the next MTRIC that happens in 2025, but also to other complementary integrative medicine conferences, and then of course publication, so they'll be able to read these results later on, right?
Yep, indeed.
Fantastic. Was there anything that I've missed or anything else that you want to make sure you get to talk about here in this space?
Well, I guess that the only other thing that I want to mention is how important our massage therapists are in this research, our MassageNet members. So everyone who is already enrolled in MassageNet either has already received or will receive an invitation for this study, and I hope you will all consider participating. And if you haven't joined MassageNet and you want to, please do join. The information is on the Massage Therapy Foundation's website. You can go to massagenet.org and sign up. We really appreciate everybody who helps and participates in all of our efforts.
Absolutely. Research enthusiasts, those are the folks who are engaging with Research Perch and certainly the other aspects the Massage Therapy Foundation does. And so again, just that invitation for all of you to participate in Sami's study. If you are a practicing massage therapist, your experiences are absolutely vital to this project and to help us inform our field, inform practice, help improve our patient outcomes and our understanding of our field. It's so important. So with that, Sami, thank you so much for all of your time, all the work that you're doing for the field. I'm super proud of you and excited for all the exciting pieces that you're engaging with. And with that, just want to thank you all for joining us for this edition of Research Perch. It's been super fun to be back here again, and we look forward to seeing you all again soon.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.